Polycystic ovarian syndrome, otherwise known as PCOS. Let's talk a bit about this condition. So what is PCOS? Well, it's actually a very common condition. In Canada, it's estimated that 1.4 million women are affected by this condition. This is also known as a syndrome. Some people actually believe it's a disease, but if we take a look at the name, polycystic ovarian syndrome, it's actually a syndrome, not a disease. This condition can also be very difficult to diagnose and treat. This is because rather than just being one disorder, it usually involves multiple different symptoms and conditions that one might have to live with. PCOS can also be diagnosed in women as early as 15 years of age, although most women do not get diagnosed till about the mid-20 to 30-year range. PCOS also affects our endocrine system. This is a system that is responsible for controlling and regulating the hormones within our body. Numerous small cysts can develop on the ovaries. Some women, however, with PCOS do not develop these cysts, which are also known as fluid-filled sacs. Small amounts of male sex hormones, androgens, are usually present in all women. However, women with PCOS will actually have higher levels of androgens in their system. And women with PCOS could also have an energetic blockage or an imbalance in energy flow. This we will get a little bit more into further on in the video. Did you know there are different types of PCOS? So I've listed here 4 different types. There are actually more, so if you'd like to take a look, I've listed the link at the bottom of the page there. But let's just take a look at the 4 that I have listed here. So the first one I've got at the top, insulin resistance PCOS. This seems to be the most common form of PCOS. It is sometimes suggested that all women with PCOS be treated for insulin resistance. The resistance can occur because the cells do not recognize that insulin is present, which in return, the cells will resist the effects of the insulin hormone. The other type that we have here is non-insulin resistant PCOS. This is also known as lean PCOS or inflammatory PCOS. So this can be the most difficult form to diagnose and treat. This is because it takes some work to actually determine what's triggering this condition. This form of PCOS may have nothing to do with being overweight or even signs of insulin resistance, which are common symptoms of PCOS. Another type of PCOS is called post-birth control PCOS, or otherwise known as temporary PCOS. So unfortunately, this form is not recognized among most OBGYNs. However, when coming off birth control, it has been shown to cause a temporary PCOS state in some women. If you are on birth control, this does not mean you will get this condition, although being aware of what is potential can save a lot of stress. And the last type that I have listed here, adrenal PCOS. So the symptoms for this form of PCOS can be similar to the insulin resistance PCOS. However, the difference will show in the lab test results. So a woman's testosterone levels may not be elevated, although levels of the androgen DHEA produced by the adrenals are actually higher. So, what is PCOS caused by? Well, the exact cause is not clear. Sometimes even a reproductive endocrinologist, family doctor, or an OBGYN may not be familiar with all there is to know and understand about this condition. However, there have been a couple of interesting points that have been noticed in women with PCOS, such as many women with this condition have an insulin resistance. This is when the body will not respond to the hormone naturally. Insulin, which is responsible for changing the food we eat into energy, will build up, which in return can cause higher androgen levels. And obesity can also play a role in increasing these levels. PCOS can also run in the family. Therefore, women who have been diagnosed or maybe have symptoms of this condition and are wondering if they have it may want to look back into their family history and do a little bit of research, as that could be a question that your medical professional will ask you if you go to speak with them about this. So let's discuss the energetic qualities that can affect PCOS. We can all experience positive and negative aspects of life, and sometimes that emotion can stick with us and cause disease, or what I like to sometimes call dis-ease. So some things to consider if you believe you may have this condition, or if you've even been diagnosed with a form of PCOS, are: what are your feelings about being a fertile, feminine, and nurturing woman? Are there feelings of being powerless? What are your feelings towards your mother? Do you guys get along? Is there tension there? Do you struggle to balance your needs while managing the needs and wants of everyone else around? And do you wear the pants in the relationship? This information is very personal and can be kept to yourself. But finding a way to release this emotion can be beneficial to our bodies. You may wish to journal or seek out a form of therapy or a holistic route that suits you best. So, how is PCOS diagnosed? Well, a diagnosis of this condition will usually involve your medical practitioner or professional asking a few questions, such as family history, as mentioned before in the causes of PCOS. You will also have a physical exam done and may also receive a pelvic exam. This is to check the health of the reproductive organs inside the body and also outside of the body. You may receive an ultrasound. You may have blood tests done. This is to rule out any other health conditions that may be present. And an AMH reading may be completed to measure the level of anti-Müllerian hormone, which relates to the woman's egg count and helps identify PCOS. Fertility and PCOS. Now, this page is also about pregnancy, so let's talk a bit about this. How is fertility affected by polycystic ovarian syndrome? Well, in some cases, a woman will not produce enough of the hormones needed to ovulate. If an anovulatory cycle occurs, it can develop many small cysts. These cysts, also known as follicles, will produce the androgen hormones that are playing a role in causing PCOS. Does this mean that women cannot become pregnant if they have polycystic ovarian syndrome? Absolutely not. Of course, it can make conception more difficult. However, taking the proper steps and knowing your body can help the fertility process. For example, if you were charting and you did not ovulate, you would observe a pattern of increasingly wet cervical fluid. But instead of drying up to the hormone progesterone, which is a hormone that is produced during pregnancy, it would be more likely to return to sporadic patches or just remain wet due to the estrogen levels, which is another hormone within our body. Now, when I say charting, I'm talking about the fertility awareness method, which is something we're going to make more videos on, because I think that is something really important to talk about. And there is a really great book to read. So we'll make some videos on that and talk more about that later. So what are some of the symptoms of PCOS? Well, symptoms of this condition may include missed or irregular periods, which are longer than 35 days or very light, ovaries that are large and may have many cysts, excess body hair. This is including the chest, stomach, and back area. Infertility, patches of excess skin. This is also known as skin tags. Dark and thick skin patches on the back of the neck, in the armpits, and under the breasts. Women may also notice a pattern of limited cervical fluid for long stretches of time. Women may also have frequent patches of fertile quality cervical fluid, which could or could not lead to ovulation. And cortisol is increased from the stress. So we also have some clinical symptoms of PCOS. This includes large white ovaries, which have what appear to be a string of pearls on the surface. And it only takes one ovary to be polycystic to raise any suspicion. This string of pearls is made up of numerous immature follicles that have never reached ovulation and grow along the edge of the ovarian tissue. Androgen levels are elevated. Again, these are the male sex hormones. And the woman may experience a reversal of the luteinizing hormone, otherwise known as LH. This hormone is responsible for ovulation. Follicular stimulating hormone, known as FSH, is responsible for follicle production and is produced in excess, which is the opposite of a normal hormone ratio. Ovulation could be abnormal. Charting your cycles would be beneficial, as you could bring the charts along to the next doctor's appointment and assist the medical practitioner in observing these cycles. So I just have a diagram here on the corner. If you take a look at that, you'll see a normal ovary, and then you'll see what a polycystic ovary looks like. So you can see that string of pearls and how it resembles a string of pearls. What are the long-term health risks associated with this condition? Polycystic ovarian syndrome can have many effects on the body that a woman may have to endure throughout her lifetime. Some of the different long-term risks associated with PCOS may include insulin resistance, metabolic syndrome, hypertension. This is known as high blood pressure, type 2 diabetes, heart disease, endometrial cancer, breast cancer, and ovarian cancer. So how is PCOS treated? Well, the treatment for PCOS will depend on many factors. This can include the age, how severe the symptoms may be, and if pregnancy is an option. It will also often involve medications, and some women may receive cosmetic surgery that include electrolysis and laser hair. How is PCOS treated if pregnancy is not an option? Birth control might be administered, and this is to help control the menstrual cycles. It will also help lower the androgen levels and reduce acne. However, birth control can have many different side effects, so it's worth doing some research into that before committing. Diabetes medications may also be administered, and this is to help control the insulin levels, which may reduce the androgen levels and slow the growth of hair. A change in the diet and activity may be suggested, as a diet change can produce the fastest results. With these lifestyle changes, symptoms may be reduced and can help the body use insulin and lower glucose levels. It can also assist with ovulation. Surgery may also be an option. Cysts can be removed surgically, although should be a last resort as it compromises fertility. Dikairoinositol, this can help to increase the action of insulin within the body. Ovarian drilling. This is a laser that punctures the ovary up to 10 times, allowing the male hormones to lower. Again, these are known as androgens. Metformin, this could be administered to help regulate blood pressure. And another form of surgery is an ovarian wedge resection. Now, if pregnancy is an option, how is PCOS treated? Well, a change in diet and activity will likely be advised. And this is because we know it can produce the fastest results. You will likely be advised to avoid foods that will cause blood sugars to rise, such as processed meats, and always eat a healthy breakfast, as skipping this meal could cause a spike. Metformin may be administered to help ovulation occur, and celiac progesterone therapy can help to counter the estrogen levels due to the lack of progesterone. Holistic practices that can help with PCOS. There are other ways that you can help ease the stress of this condition. This may include a holistic practice such as reflexology or Reiki. There are many benefits to both of these practices. And as mentioned before, with the energetic qualities of this condition, there are different things that you may want to consider. So how can reflexology or Reiki support the body to heal these feelings and symptoms associated with PCOS? So we mentioned reflexology, so let's talk a bit about that practice. Now, I do want to mention reflexology never replaces medical care. We never work in opposition to medical practitioners. We work with them. So this can be a very stressful time for any woman. And it's nice to have that space holder there to help take the weight off their shoulders. Now, when I say space holder, I don't mean a therapist or anything like that. I am just merely talking about somebody that is there to listen and hold that space for you, validating your feelings, no matter what they are, whether you think they're right or they're wrong. We are not here to judge. A reflexologist is there to hold that space, validate those feelings, and just be there for you. So a reflexologist knows which points to work on for the endocrine system. Now, we know that PCOS affects the endocrine system, which is the system that controls and regulates our hormones. Reflexology has also been known to help regulate the menstrual cycle and can help reduce the number of follicles within the ovaries. Many women with PCOS have stated reflexology has helped with the symptoms. And I do truly believe that the power of touch can be a powerful thing. So during a session, a reflexology session, you may experience different things because there's different ways you can do reflexology. However, just to list a few points of that I would work on during a session, because I do offer reflexology. So these are some of the points that I would work on during a session. I'd work on your ovaries, which can help with healing and hormonal balance. I'd work on your fallopian tubes to assist with the healthy functioning and healing. I'd work on your pituitary gland, also known as your master gland, and this is for hormonal balance and support of the ovarian function. I'd work on the hypothalamus, and this is to support the pituitary gland. I would also work on the pineal gland to help with sleep and regulation of the menstrual cycle, also to help with regulation of temperatures and emotional balance, along with sexual function. I would work on the liver and gallbladder to release any anger we are holding on to, as we tend to, if we do have any anger, that's where we're storing it. If we have any resentment or anything, it is being stored in our liver. We would also work on your solar plexus chakra. This is to help with stepping into one's will and one's power. We also mentioned Reiki. So let's take a look at Reiki and see what it's about. Now, I do have a small video here on the side just to kind of give you an idea of what Reiki might look like. But let's just get into it a little bit deeper. So again, I do want to mention that just the same as reflexology, Reiki does not replace medical care. We will never work in opposition with a medical practitioner. Again, we work with them. So seeing a Reiki practitioner can also be effective at easing some of these symptoms from PCOS. Reiki can be used for swelling, pain, even emotional turmoil. Trauma can occur from hormone medical therapies. So Reiki can help bring our bodies back to a state of homeostasis. Reiki can help provide willpower, strength, and faith when faced with a challenging situation. Reiki is a very relaxing process, as you can see in the video there. It can help the body remove stress and aid with better sleep. It can be another form of having somebody to hold that space during a frustrating time. So not just reflexologists are space holders. Reiki practitioners are reflexologists. I am sure you will find many different practices out there that are willing to hold space, because I think it's important. We all need to vent and let go and release that emotion. So the practitioner may be able to guide a woman and inform her of all the different treatments available. So not only is this a very stressful time because you have all this stuff going on in your body and you're like, I don't know what's going on here. On top of that, you have to worry about all the different treatments and everything, and who do you go to see next, and who do you talk to? Well, if you're seeing a Reiki practitioner or even a reflexologist, they're likely well known, or they're likely they likely know the community services in your area. So check with them. I mean, if you do have a Reiki practitioner or a reflexologist and you think you are experiencing these conditions, because they might be able to help point you in the right direction. You should seek medical care if you are experiencing missed or irregular periods that are longer than 35 days, if you notice an excess amount of hair growth, if you notice abnormal amounts of acne or excess weight gain, and if you notice an anovulation cycle, so which is not ovulating. So if you haven't ovulated, you definitely want to speak with your medical practitioner. It is very important to know and understand your body. So if something seems out of place, it's always a great idea to speak with your doctor, medical practitioner, whoever it is. Whether you are experiencing missed or irregular periods, or you're noticing acne or whatever it may be, if it's not any of those symptoms, it doesn't matter. If you think something is not right or is out of whack, talk with your doctor or a medical professional to see what is going on. Some things you might want to consider before you go to your doctor's appointment is to write down questions to ask your medical professional at your next appointment. You may want to bring someone whom is trustworthy, who can help remember things such as certain questions, or even to help remember exactly what the medical practitioner is explaining, as it can be a lot to take in all at once. You can also bring a notepad or a book to your appointment, and this will help you to keep notes, and you can refer back to them and say, oh yeah, this is what he said. Okay. So just keep those things in mind. But most importantly, if you think something is wrong, or, if something seems suspicious to you, always speak to your medical practitioner. As we near the end of the video, I would like to discuss some community resources that might be available to you. You could easily do a quick search of what might be closest to you. For example, in the town of Belleville, Ontario, which is quite a small area, You do have options to speak with your family doctor if you have access to one. If not, there are clinics that you could go to, and they may be able to assist with the process or at least guide you in the right direction. So that way you could speak with an OBGYN or whoever it is you need to speak with. If you are like myself and are intrigued by the holistic route, you could try reflexology, Reiki, or even speak with a reproduction specialist if pregnancy is an option. Another great option is speaking with a nutritionist or even a therapist. And again, speaking of Belleville, there is access to Nutrition House and a lovely center called We Thrive, where you can receive a number of different holistic and therapeutic practices, such as reflexology, energy healing, and psychotherapy, which can help to address emotional, mental, and spiritual difficulties. And so we've reached the end of the video. And just to give everybody another reminder, I am a holistic reproductive practitioner who focuses in reflexology, Reiki, and doula services. I am not a medical professional in any way, so I am not here to diagnose or, treat or cure any of these conditions. My main goal with this page is just to bring more awareness, to inform others of different conditions, of different things that our body goes through, and just bring that awareness. So thank you all for taking the time, watching the video, and learning about polycystic ovarian syndrome. I do appreciate it. And again, thank you. Have a lovely day.